I want to talk today about osteoporosis of the skull. Most doctors and dentists won't tell you about osteoporosis of the skull, although this is what gives people that little old person look. You can tell if somebody's in their 60s and 70s and 80s just by looking at their face. They may be filled out, they may be overweight in the rest of their body, but that face gives it away because they're losing bone mass in their face. And when that happens, the loss of minerals results in a higher rate of what's called bone matrix. Bone matrix is kind of like the tendon-like rebar that the minerals sit on in all bones in your body. And, of course, doctors talk to you about osteoporosis in your legs and your pelvis and in your vertebrae and your ribs, but they never talk about the osteoporosis in your skull. A very common problem with osteoporosis in the skull are dental problems, periodontal disease. A bone in your face goes away. Well, the tooth gets loose, teeth get loose. Doctors want to pull them, do dentures, they'll do implants, and really all you have to do is avoid all the bad stuff, including inflammatory things, fried foods, processed meats, oils, and gluten. Stay away from carbonated drinks, which actually decrease the amount of minerals you can absorb by neutralizing your stomach acid. And you'll find you supplement with all 90 essential nutrients that you will reduce the rate of periodontal disease, and a lot of dental work will be avoided, right? And then, let's see here, that includes TMJ and things of that nature. Then also you can have vascular dementia because the carotid artery comes up from the heart, brings blood into the brain, and it has to pass through the base of the skull to get into the brain, where you get the cerebral arteries. Well, you can have blockages of the cerebral arteries in the skull, inside the skull, but also you can get blockage of the carotid arteries outside the skull, and you're not getting enough blood into the skull, not enough oxygen, not enough food, and this results in a type of vascular dementia. Then, looking at the cranial nerves, there's 12 pairs of cranial nerves, 12 pairs, which means there's 12 come out from the brain through the skull on each side, and they begin to get squeezed because the tunnels that they go through, the canals they go through in the skull, begin to get filled up with this bone matrix, this tendon-like material that takes the place of minerals. Well, let's look at cranial nerve 1, which are the olfactory nerves. The little face plate on the front of your skull, where your nose goes into, this is where the olfactory nerves go into the skull. It's cranial nerve number 1, actually multiples of nerves, and it begins to get squeezed. And, of course, you can lose your sense of smell because of a zinc deficiency, but you can also begin to lose your sense of smell because these little nerves are being squeezed. And there's cranial nerve number 2, which is your optic nerve. This is the big nerve that comes from your brain through the skull into your eye. A lot of people will get optic nerve vascular problems because it squeezes the optic nerve, and there's a little blood vessel that comes right through the center of that optic nerve to supply blood to the eye. But also, you can get a demyelinating problem in the optic nerve, meaning that the sort of insulation material that protects that optic nerve starts to deteriorate because it's getting squeezed from osteoporosis of the skull. And then there's a cranial nerve number 3, which controls the eye muscles, and you can consciously move your eye around. This gets squeezed, and you lose that ability. And then there's cranial nerve number 5. This is called the trigeminal nerve. It has 3 main branches, so it's trigeminal nerve. And when it gets squeezed, you get trigeminal neuralgia, which is very, very painful in your upper jaw and your lower jaw. And dentists will love to do a root canal, and the pain goes away, not because they've solved the problem, but because they've yanked the nerves out of the roots of your teeth. And so the pain is still there, but you can't feel it because they ripped your nerves out. And the French call it tic de la roue, very, very painful stuff. And then cranial nerve number 7. When that gets squeezed, you get Bell's palsy. Your face droops, looks like you've had a stroke. And then, of course, there are some branches of the 7th cranial nerve which go to your eye and actually tell your tear glands to make tears, and you get dry eye. This is caused by cranial nerve number 7 being squeezed, or dry mouth. Again, branches of the cranial nerve number 7 being squeezed. And then cranial nerve number 8, very, very important. You can get tinnitus, ringing in the ears. Okay, you can also have a slow loss of hearing. That's the auditory branch of the 8th cranial nerve being squeezed. These are all repairable, of course. You got to deal with the osteoporosis of the skull. You're talking about healthy bone and joint pack, 1 per 100 pounds of body weight. And you can put the CM cream down in your ear with a Q-tip, relieve a lot of that inflammation, and the tinnitus, ringing in the ear can go away very quickly within 10, 15 minutes. but it'll gradually come back in a couple hours. It'll take 4 to 6 months to support and promote maintenance and repair of the bones in your skull. And then the vestibular branch of the cranial nerve, it was used to be called Meniere's disease, now Wallach's vertigo, where you feel like you have motion sickness, a little bit of nausea, and this is, again, easily prevented, easily reversed by taking the 90 essential nutrients appropriate for the bone loss. Then there's the ninth cranial nerve. The ninth cranial nerve, the glossopharyngeal nerve, has to do with taste, also has to do with your vocal cords, and people begin to gradually lose their voice. And again, this is caused by the tunnel the ninth cranial nerve is coming out of in the base of your skull, down into your tongue and your larynx, and the vocal cord being squeezed by osteoporosis. Again, reversible. And then cranial nerve number 10, the vagus nerve. This is the big one. Vagus nerve goes from the base of your skull down along with your carotid artery, down into your chest, helps control the stuff in your chest. There's actually a branch of it called the recurrent nerve, the vagus nerve. When this gets squeezed, when the roots of that recurrent nerve gets squeezed as it's coming through the skull, you've heard these people get the hiccups. They just can't do anything about the hiccups, but that recurrent nerve controls the diaphragm. Okay? So all of this is prevented by taking the 90 essential nutrients appropriate to prevent and reverse osteoporosis of all bones in the body, including the skull. Get a hold of that book, Epigenetics, the book, Rare Earths, Been Cures, and the book, Dead Doctors Don't Lie, and you'll find out how to prevent all this stuff. We'll be back with Dead Doctors Don't Lie after these messages.
If you're the type of person who likes to volunteer and help others, this should interest you. What better way to help people than to help them overcome their health challenges? Longevity has been helping people overcome their health challenges for years. Our approach to health is drastically different than medical doctors who mostly only treat symptoms. As a veterinarian, Dr. Joel Wallach discovered that many common disease states are actually preventable and reversible. Our mission at Longevity is to educate Americans about their own health. If you like helping people, join us in our fight to save America. While you're helping people prevent and overcome health challenges, you will also be able to build a lucrative home-based business. So what are you waiting for? Come join us and help save America. If you've decided to join us, call your local Longevity associate to find out how you can arm yourself with the knowledge that's needed to save America.
Numerous studies have shown the link between the intake of antioxidants and disease prevention. Foods and supplements are measured in an ORAC scale. ORAC is an acronym for Oxygen Radical Absorption Capacity. In other words, the ability to remove disease-causing free radicals from the human body. Longevity's Cell Shield RTQ has an ORAC value of 15,800 points per serving. Cell Shield RTQ contains resveratrol, known as an anti-aging compound, turmeric, known for promoting healthy digestion, brain function, immune system, and cellular longevity. Quercetin, a flavonoid, is known for promoting healthy blood sugar metabolism and healthy lung and cardiovascular function. Remove free radicals from your body with Cell Shield RTQ from Longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk a bit about fish oil today, as I have a story here from Reuters News. It's headlined, "Fats from Fish and Plants May Help Older Adults Live Longer." They say older adults who eat plenty of fish and vegetables may live longer than people who don't in a large Swedish study. They looked at a little over 4,000 60-year-old men and women, and those with the highest levels of polyunsaturated fats, or PUFAs, which come from fish and plants, were significantly less likely to die from heart disease or any other cause, about 15 years, than those with the lowest levels, according to the lead author here, Dr. Ulf Rizeris, a nutritional researcher at Uppsala University in Sweden, says the study supports current dietary guidelines that advise having sufficient intake of both fish and vegetable oils in a heart-healthy diet. Yeah, this is another one of those ones, Doc, where they get part of it right, but they're still recommending that people use oils, which, I know you have said for many years that oils aren't good for you. And they say these polyunsaturated and monounsaturated fats are the good kind that can promote healthy cholesterol levels, especially when used in place of saturated and trans fats, the bad actors. They say good fats are found in fish such as salmon, trout, and herring, as well as avocados, olives, walnuts, and liquid vegetable oils such as soybean, corn, safflower, canola oil, olive, and sunflower oils. They say current dietary guidelines, that is, I say most adults should get no more than 20 to 35% of their daily calories from fats, and most of that should come from the good fats, with no more than 10% of these saturated fats and as little trans fats as possible. The American Heart, this was all published in the American Heart Association journal Circulation. Say evidence suggests that the types of fats people consume may be more important than the quantity in affecting the fatty acids circulating in the bloodstream, as well as cardiovascular risk. Because, that's something you've been talking about for a number of years of, taking the good fats and staying away from the bad fats. A little later in this story, they talk about, EPAs and DHAs, and that those that were getting those associated to a 20% lower risk of death. And they say those with the highest levels of ALA, or alpha-linoleic acids, were 72% higher risk of cardiovascular disease compared with women with the lowest levels. So there you go.
Yeah, and of course, this is one of my 8 lawsuits against the FDA and federal court, and I prevailed to say that omega-3 deficiencies, which are these polyunsaturated good fats, the omega-3s, and the right ratio of omega-3, 6s, and 9s, actually prevent thrombotic coronary artery disease and thrombotic stroke. And it's the most common cause of stroke and one of the common causes of heart attacks. And, of course, we have that as part of the 90 essential nutrients. That's our EFAs and EFA pluses. And, of course, what makes us different is we prevent them from oxidizing and turning into trans fatty acids, because the good things have a double-edged sword. You can, all the good fats, the trans fatty acids can turn into trans fatty acids and heterocyclic amines and acrylamides if they're in contact with oxygen. So what we do is we actually fill our soft gel capsules in a nitrogen oxygen-free atmosphere, and we bubble nitrogen through these capsules before they're sealed. So our omega-3s do not have any oxygen in the capsule, so they don't oxidize. If you take bulk oils, a lot of people say, oh yeah, I just take a tablespoon of that oil every day. Ugh, you're in trouble. Or if you take some of these cheaper ones that don't actually do it in nitrogen, you're in trouble because they oxidize. But thank you for bringing that up. It's a very important part of the 90 essential nutrients. We'll be back with Dead Doctors Don't Lie after these messages.
Fish has been thought of as a brain food for eons, but it's not the fish that's key. It's actually the essential fatty acids, EFAs, or omega-3s found in fish, called essential because they're necessary for good health and your body can't make them. So they must be consumed through diet or supplementation. Youngevity has developed the perfect supplement in SmartFX, an acronym for Sustained Memory and Retrieval Time, a concentration of DHA and EPA, both members of the omega-3 family, supporting neural path function and cardiovascular health for optimal mental concentration, awareness, focus, and agility. If you've got a mentally demanding career, you're a student crunching for the big test, or just want to maintain health for a sense of well-being, try SmartFX from Youngevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Youngevity developed OsteoFX Plus, containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention, OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables. And besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. Let's head to Idaho, and Janie, you're on with Dr. Wallach.
Oh, Janie, you're on the air.
Hello, how are you?
Hi. How can I help you?
Yes, I have a female, 44 years old. She has endometriosis, Hashimoto's disease, and she's borderline diabetic. They just put her on Armour Thyroid once a day for 30 milligrams, and they've put her on metformin at 500 milligrams 3 times a day. she has polycystic ovarian syndrome, and she's taking the Beyond Tangy Tangerine powder every day, but I'm not sure how much, and I was wondering what you recommend. That
Sure. How much does she weigh? Janie, how much does this lady weigh?
About 130.
Okay, this is a Shar thing. Shar, are you there?
Hello?
Shar, are you there?
I'm here.
Okay. Okay, here's a 130-pound lady, has endometriosis. She has low thyroid problems. She's got prediabetes. She's getting medicated for both the thyroid and the diabetes. And she's got polycystic ovary disease, which kind of goes along with the endometriosis. What would you do for her?
Well, I'd get her on a gluten-free diet, and then I would give her the healthy blood sugar pack, and I would also give her the Woman's FX and the Xerafem.
Okay, what would you do for the thyroid problems?
Give her the Ocean's Gold, of course.
Very good, of course. Very good. Okay, perfect. So, Shar says here, Janie, you're going to give this lady the one healthy blood sugar pack, but I'd also get her an extra bottle of the Sweeties, so you could take 3 Sweeties twice a day. You need to check her fasting blood sugar every morning before she medicates herself, and then adjust the medication appropriate to her blood sugar levels. For her thyroid, Shar said she could take the Ocean's Gold and have her take 3 of those twice a day, be 2 bottles a month, and stay away from cruciferous vegetables, including all the other bad stuff, the fried foods, the processed meats, the oils, and gluten, but I'd also have her stay away from cruciferous vegetables, which would be cabbage, broccoli, cauliflower, Brussels sprouts, and kale. And as Shar said, for the polycystic ovary disease and the endometriosis, I would give her the Woman's Effects, 2 ounces a day, ounce of breakfast, ounce of dinner. That'd be 1 bottle a month, 2 bottles a month. And then I would also give her the Xerafem, Xerafem, and they're designed to deal with these sorts of things. And give us a call every couple of weeks. Let us know how this lady's doing. If there's any questions, call any time, but do call us as things progress here, and we'll walk you ladies through this. And we'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages.
Let's head to Sedalia, Colorado, and Robert, you're on with Dr. Wallach.
Oh, Robert, you're on the air.
Hi, Dr. Wallach. Thanks for taking my call.
Yes, sir. What's up?
I'm calling in for my new CEO, Heather. She is dealing with narcolepsy, and we're wondering about what she needs to take. She's on the Healthy Body Start Pack, just started with that. But she's here sitting with me and would love your program for her.
Okay, well, how much does she weigh?
Hi, I'm Heather. I weigh 112 pounds.
112 pounds?
Yes, sir.
Okay. Now, let me ask you a question. Do you get drowsy after you eat?
Yes.
Okay. And let's see here. Who diagnosed you with narcolepsy?
My neurologist when I was 16 years old. And I'm 30 now. Mm-hmm.
Okay, and you're 30 years old now?
Mm-hmm.
Mm-hmm. And you were falling asleep all the time?
Yes, sir. During school, I actually fell asleep at a red light one time when I was 16, and that's when my mom scheduled the appointment.
Mm-hmm. Good. Well, narcolepsy, it's an old-timey term. That goes back literally hundreds of years ago. The new understanding of it, of course, is that it's called reactive hypoglycemia or hyperinsulinemia, and you take in carbohydrates like sugar, cereal for breakfast or oatmeal for breakfast kind of thing, or some juice for breakfast or fruit for breakfast, and then about an hour later you start getting sleepy, or a half hour after your meal you start getting sleepy, or you have some pasta at lunchtime, and of course the bread or the noodles turn into sugar, and your insulin will knock your blood sugar down, and you get drowsy. This is what causes it. Do you have any skin problems, any eczema, dermatitis, psoriasis, or any history of asthma?
No.
Okay. Do you have any history of bowel problems?
No.
Okay. Do you have any children?
Brain lesions. I have brain lesions, too. They kind of found them. The neurologist found them at the same time that they diagnosed me with narcolepsy. But they're idiopathic. We don't know why they're there. I don't know.
Wait a minute. And what kind of brain lesions? Did they look like MS, multiple sclerosis?
Yeah, similarly, but I went to the Mayo Clinic in 2010 and got a spinal tap, and it was negative, but they did say that it was a seasonal diagnosis, and I haven't been back, but They don't know. It's idiopathic. They don't know why.
Well, you know what idiopathic means, don't you? It means the idiots don't know what it is.
Right.
Okay, so here we go. Okay, get your pen and paper out. Shar, this is a Shar thing. Are you there?
I'm here.
Okay, narcolepsy is reactive hypoglycemia. Blood sugar goes down because of the insulin is released in excessive amounts after a carbohydrate or sugar intake, either a full meal or even a snack. And so what would you do? And she also has MS-like lesions in the brain, which really have nothing to do with the narcolepsy. It's two different things. There's nothing that says you can't have two different problems. So hang on. We'll be back, and Shar and I will give you a program here after these messages. Okay, Doug, let's go right back to Colorado and Robert and Heather. And basically, Shar, are you there?
I'm here.
Okay, so she's got this reactive hypoglycemia, and she's got sort of MS-like lesions in the brain. And so what would you do for this lady, 112 pounds?
I would get her on a gluten-free diet for sure, and I would get her on a healthy blood sugar pack, and then I would also give her, make sure she eats a lot of eggs and butter, soft scrambled in butter.
Mm-hmm. Okay. And how would you deal with the lesions? What would you do for anti-inflammatory stuff in the brain?
Inflammatory stuff in the brain? Well, she should be taking selenium, too, but for the inflammation and stuff, she could be taking the CM capsule, CM Plus soft gels.
Yeah, could do that. And the let's see here, Cell Shield RTQ and the triple treat chocolate and all that kind of stuff, right?
Right.
Okay, so now let's, and Char's exactly right here, Robert and Heather. 112 pounds, I'd have you take, let's see here, one healthy blood sugar pack per month, Char's correct, one healthy blood sugar pack per month, get an extra bottle of the Sweeties, so you could take 3 Sweeties twice a day. And also, because she has these lesions in her brain, get 2 bottles a month of the Ultimate Selenium, have her take 3 of those twice a day. And then also, she needs to get 100,000 ORIC points, anti-inflammatory stuff here, deal with the free radical damage in the brain. And so that would be, as Shar said, she could use the triple treat chocolate. I'd have her take 6 of those a day, 2 at breakfast, 2 at lunch, 2 at dinner, or the Cell Shield RTQ. She could take 3 of those twice a day. That's going to give her 100,000 ORIC points and help the immune system deal with these lesions in the brain. 6 to 8 eggs a day, poached with soft yolk, soft boiled with soft yolk, soft scrambled in butter. And, of course, the lesions, when you have MS-like lesions in the brain, the myelin, the insulation material, you have to replace the cholesterol because myelin, which makes up 75% of your brain weight, is almost 100% cholesterol. So the eggs are imperative for giving your brain the raw material to deal with all this. And it's imperative to stay away from sugar. I mean, really stay away from sugar. That means dried fruit, fresh fruit, absolutely no juices. This includes agave syrup, maple syrup, molasses, honey, things you think of as being kind of benign or healthy. And I would be, 1 slice of bread, of any kind of bread, white bread, multigrain bread, a couple of tablespoons of pasta, noodles. This increases your blood sugar faster than a heaping tablespoon of table sugar. And, of course, before bed, you ought to have a couple of scrambled eggs and butter. Wouldn't hurt when you have breakfast every morning. Absolutely no cereal, right? What you want to do is have your eggs, and I would take something a little more safe. Sweet potatoes, a small serving of sweet potatoes with some butter, or one of our protein shakes would be good. Throw your eggs in the protein shakes, make it with half and half, or with heavy whipping cream, and stay away from sugar. Okay, call us every couple of weeks, Robert and Heather, and let us know how you're doing, because this stuff should resolve itself very quickly. Very simple problem. Okay, Doug, let's go to callers.
Let's go to San Diego, California. And Sandy, you're on with Dr. Wallach.
Hello, Sandy, you're on the air.
Yes. Hi, Doc. Can you hear me okay?
Yes, ma'am. How can we help you?
Yes, I have a real problem with overactive bladder and incontinence. I had a hysterectomy when I was in my 20s, and it's getting to be a real problem. I'm very athletic, and I get leakage. I get bladder infections and irritations a lot, and I want to know what I can do. I have your bladder and kidney formula. I don't know if that's enough.
Okay, now, let me ask you a couple of questions.
Okay.
Do you have a back problem?
Yes, I do now. I have an instability problem in my L5 in my back.
Mm-hmm. Okay.
And
Shar, what do you weigh here, Sandy?
I weigh about 140.
Okay, this is a very simple problem. Shar, what would you think here? Here's a 140-pound lady, got a back problem, and she's got incontinence, meaning, she dribbles urine. She might cough and have some urine, might wake up several times at night to go to the bathroom. We know it's not a prostate problem because she's a lady. Irritable bladder syndrome, UTI stuff. This has been going on for some years. What would you attribute this to, Shar?
Back problem.
Yep, back problem. What would you do for that?
I get her on the healthy bone and joint packs.
Mm-hmm. Very good. Now, have you shrunk any in height, Sandy, that you know of?
Oh, are you talking to me? I'm having a hard time hearing you. What?
Or is your name Sandy?
Yes.
Okay. Do you have a history of shrinking? Are you shorter now than when you were 20 years old?
I don't, but I'm definitely on your, I'm on the OsteoFix because I know I've got osteoporotic because I have arthritis and lots of bone spurs in my neck and back. And that told me right there I've got a problem with calcium, so I'm on your OsteoFix. So here's what's happening here. You have, amongst all these bone spurs, you also have degenerative disc disease in your lower back, your lumbar area, and the spinal nerves, the sciatic nerves. When the external branches of the sciatic nerves get squeezed, you get restless leg syndrome when you lay down or sit in a funny chair, or you can get sciatica, peripheral neuropathies. When the internal branch of the sciatic nerve gets squeezed, guess what? You start getting incontinence, bladder problems, symptoms of burning on urination. Doctors will diagnose it as UTIs, urinary tract infections, when really it's all a back problem. Char is exactly correct. I'm going to get rid of all the bad stuff, all the inflammatory stuff. Absolutely no fried foods, no processed meats with nitrates and nitrites, no oils, no gluten. I would also take 2 healthy bone and joint packs per month, take a full dose of everything twice a day. It would be 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EPA Pluses at breakfast and dinner, 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner to support and promote maintain repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, very important here. And then also, with those 2 healthy bone and joint packs, you're going to get some CM cream, and I would apply that to your lower back from L1 all the way down to your sacral area, right down the middle and on an inch of either side of the middle. And a lot of times the anti-inflammatory properties there will help relieve a lot of these symptoms. But it's going to take, the 2 healthy bone and joint packs might take you 4 to 6 months to support and promote maintenance repair enough to permanently relieve yourself of these symptoms. Do not get any surgery anymore. You've already had some surgery, had a hysterectomy. But I would definitely watch for these bone spurs will gradually go away. They can just go right back into the bone. You don't need surgery for those. And watch your symptoms. They will definitely get better and go away. Give us a call every couple of weeks and give us a report because you're going to have some great testimonies here, Sandy. Okay, Doug, we got time to start another one?
No, we're just about at break time.
Okay, well, I'll just remind everybody about our new tools to help you build your longevity business. Book Epigenetics, The Death of the Genetic Theory of Disease Transmission. Somebody Needs to Go to Jail, the DVD, and Public Enemy #1, the new CD. They're add-ons to the Dead Doctors Don't Lie series. It's all the same information, but 25 more years of information to show that what I said 25 years ago was correct. We'll be back with Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 Flat Crusade. And Doug, let's go to callers.
Let's stay there in Southern California. And Michael, you're on with Dr. Wallach.
Well, Michael, you're on the air.
Thank you, Doctor.
Yes, sir. How can we help you?
Yes, I have an under 2-year-old female dog, large breed, and She has not had any vaccinations. She came from a fabulous show stock. She is extremely healthy, other than she has her rear teats that hang out low, and she looks like she's pregnant there, or had been pregnant and already done milking of her puppies. And that area is very warm to the touch, warmer than the rest of the body.
Okay, now did you say rear teeth or rear
teats?
Nipples.
Teats.
Oh, teats.
Nipples.
Okay. All right. How much do you think this dog weighs?
This dog weighs about 130, 40 pounds.
Okay. And you say she's dripping secretions or milk or something?
She is not, but there is a little white caps on the bottom of the teats, of the nipples. But no, it's just a sagging area of looks like a sac that had been milked.
Okay. Any other issues? Does she have any hot spots where she's licking, and she's a raw place on her skin, in between her toes, anything like that?
No, she's on an all-organic diet, and she's very healthy.
Okay.
Grain-free.
All right.
Grain-free.
Okay, very good. Okay, Shar, this is a Shar thing. Here's a dog with breast and nipple problems, 130 pounds, kind of like a small woman. What would you do for her?
I'll give her the Arthrodex and get her on a gluten-free diet.
No, she's gluten-free. She's already gluten-free. Arthrodex is good. I would go ahead and give her one full scoop, one full scoop for 25 pounds, so she needs 5 scoops of Arthrodex a day. 5 scoops because 1 scoop per 25 pounds, so she needs 5 scoops of Arthrodex a day in her food. And then I would give her 5 of the EFA pluses a day. That would be the EFA pluses. I go ahead and just throw them in her food, mix them up with her food. She'll probably just take them right down. If not, you have to throw them down her throat or puncture them and squirt them on her food. And then what would you do for, if this was a woman with fibrocystic breast disease, what 2 products would you give her?
I would give her the Woman's FX and the Xerofilm.
Perfect. Okay. So, I'd go ahead and give this dog, I'd start out with 1 ounce a day of the Woman's FX, a liquid. So I'd give her a tablespoon twice a day, which is the 2 half ounces, because a half ounce is a tablespoon. 1 quart will last a month. And it's a blend of 150 herbs, which are just fabulous when it comes to these sorts of things. And then, of course, the Xerofilm is a newer product which deals with nutrients for dealing with hormonal issues. Was this dog spayed, do you know, or is she still intact?
No, she's not fixed.
Okay, not fixed. Okay. Yeah, so I'd go ahead and give her the Xerofilm also. I'd go ahead and give her 3 of those twice, maybe 2 bottles a month, the Xerofilm. And then call us, say, in 30 days and 60 days, and let us know how this looks, because I think you're going to see a benefit here. And this is going to have all kinds of benefits because of the nutrition in the 5 scoops of the Arthrodex and the 5 EFA pluses a day. Okay, Doug, we got time to start another one?
No, we're about 30 seconds out.
Okay, 30 seconds out, so I'll go ahead and take it. Remind everybody about our new tools to help you build your longevity business. Get a check from us. Your products are then free. Epigenetics, The Death of the Genetic Theory of Disease Transmission. The new DVD, Somebody Needs to Go to Jail. And the new CD, Public Enemy #1. And these are just sort of a continuum of the Dead Doctors Don't Lie series, showing that 25 years ago when I said these things, guess what? They were true then. They're true again today. This is just more evidence to prove what I was saying 25 years ago was correct. Epigenetics, the book, Somebody Needs to Go to Jail, the DVD, and Public Enemy #1, the CD. And thank you, Shar. Super job as usual. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA
FDA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. When you perspire, working or playing, your body is losing more than just water. That's why it tastes salty. But what you're sweating out is more than just salt and potassium, as some sports drinks will have you believe. One of the most well-known sports drinks only has 2 nutrients, and it's loaded with sugar. Some have a mineral or two with a couple of vitamins. Youngevity's exceptional sports drink, Rebound FX, is chock full of cancer-fighting antioxidants, a full spectrum of vitamins, plant-derived minerals, and herbs. Rebound FX is a highly absorbable liquid supplement that gives you quick, sustained energy. Rebound FX supports cardiovascular health, immune health, and boosts stamina and energy. Don't short yourself during and after your workout with just a couple of nutrients. Drink Youngevity's Rebound FX for optimal health. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
If you've been diagnosed with type 2 diabetes, prediabetes, or the metabolic syndrome, and you're tired of seeing your blood glucose levels rise and fall like a ship on the ocean, but you don't want to take those drugs the rest of your life, Youngevity has an alternative. A product called Sweeties has been developed just for you. Used as part of your regular diet, Sweeties helps maintain healthy blood sugar levels, a formulation specially designed to nutritionally assist your body with the regulation of your blood sugar level. Sweeties supports healthy glucose metabolism because it's fortified with aspartic acid, chromium, and vanadium, all to help you promote healthy blood sugar levels. If you want to get off those drugs and control your blood sugar metabolism naturally, try Youngevity's Sweeties product. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.